Please come to main group. Okay, so I hope each group would have a leader now. So from group 1, that is break room 1, any one of you, can you just discuss or present whatever you have discussed?
I miss.
Okay, be a little bit louder.
Okay. Hi, Miss. Can hear me, right?
Yes, can hear.
Okay. Can we request again for more discussion
One
time?
minute, 1 minute. Somebody has asked for more discussion time.
Yes. Yes. Yes.
You want more discussion time now?
Yes. Yeah. I mean,
Okay,
like
so how long you
the
want?
time wasn't. Sorry.
How long you want? No, how long? Like another 15 minutes is enough, or you want 30 minutes?
Can you give us like 10 minutes more?
Okay, so for me, if you are really discussing, then no issues. Maybe we can meet after by 2:45 after 15 minutes.
15 minutes. 2:45. Okay.
Okay.
Okay. Thank you, Miss.
Or you want a half an hour? We can meet by 3 o'clock. No problem.
Oh, I see. Uh,
Okay, so you start discussing now. By 2:50, I will enter in each break room, and by 3 o'clock, we will open to all. Is that clear?
okay. Okay, Miss.
Okay. So do join the break room fast so that you can discuss.
Okay. Thank you. Thank you. Hi, Miss.
Sorry, you have any doubt?
Yes, Miss. I have a few questions from me myself. So, firstly, for stroking, like you'll be area apply on like a smooth, right? And the smooth without
One
any
minute, one
pressure.
minute, 1 minute.
Sorry. Okay.
Yes, tell me.
Yes. For stroking, right? Stroking the massage on the face. Okay. So it will be like a smooth, like a the pressure is very minimal, right? Then do it from down to up towards the forehead, right? This is called the stroking.
Yes. You need to do with the fingers from the chin to the forehead.
For the chin to the forehead.
Yes.
Okay.
So you need to use the fingertips.
Fingertips. Yes. Yes. Okay.
Okay. And from the chin to the forehead, then you can bring it back like a mild touch. Then you can go for the next time.
Okay. Just stroking just one time, right? Just do for one time, or
Yeah,
just
in one area, one time. So you have to cover up the whole face.
okay. Okay.
So when you do, first you will be doing to the whole from the chin to the forehead. Then next again from the, you have to come back to the chin. Then you can take up, you can go near your nose and you can go up like that. So you have to
Okay.
see to that you are covering the whole face.
Okay. Noted, Miss.
Okay. Any other question?
Miss, for the circular friction over the orbit, I should do like this, right? With the two fingers like over the eyeball,
Okay.
right?
That is stroking.
Stroking.
Circular friction should be using your thumb.
Thumb.
Yes.
Oh, using my thumb. Just like
And
circle
do the
friction.
circular
Oh,
movement. Yes. Complete
circle
friction.
friction over the orbit, right?
Yes.
Okay. Okay, I got it, Miss. Okay.
No, actually you need to do 1 minute.
Okay.
You have to keep your thumb and you have to do like this.
Oh, I
This is
see.
circular friction.
Okay.
Complete like that. Okay. So like this, if you're doing it is stroking, orbit
Stroking.
stroking.
Okay.
So when you are performing stroking starting, you will be doing from down, go up,
So,
then come back, then again second time like
okay.
that, then again third time, so that you are covering the whole area.
Oh, I see.
So like that. So number
Okay.
of times depends on the area covered. Some people, if they are very thin, you can complete in two times. Some people very fat, you need some 5 or 6 times.
Okay. If you are needing.
Next.
Okay. So Miss, for like compression, will be I don't really get it. So we just like using our finger to press on the muscle, the bulky muscle part. Mm-hmm.
No, whole, like a cupped hand, you need to
Uh-huh.
use it
Oh, the
like this.
whole
Yes, whole hand.
hand
Yes.
over
You
the
have to
eyes,
use like
over the.
a, yes. You can just use like this, both cheek,
Mm-hmm.
then like this, then over the eyes like this, then
Mm-hmm.
forehead like this.
Okay. Okay. So Miss, I would like to make sure that sort of friction
Yes,
will be normally do through the bony area, right?
yes. Only
Normally.
bony area.
Okay. So for like hiking also, we do on the bulky muscles like cheek.
Muscles, only on the
Okay.
muscles.
Okay. If same goes to the tapping. So for means for the tapping, the fingers will be like, um, should be
Like
like
tapping
this.
over the piano,
Yeah. Uh-huh. Yeah. Over the cheek,
over the
then
cheek.
over the
Even you
cheek,
can also do over
forehead.
the forehead.
Okay.
Tapping you can do over the bony areas also, because it
Okay.
won't be so painful. It's very light technique. That is
Okay.
the lightest form of the technique.
Okay. Stroke of face. Circular frictions over the face.
So
Okay.
other five, any other doubt? All the five people are there, or just in the, or they left?
They are there, sir. Miss. Sorry.
Miss, the
Yes.
one the transverse friction over forehead is how?
Transverse friction, you can just in friction. I think in one slide there was 4 types. Cyriax type. So from one finger you can just spread like this. So you can also use this kind of transverse friction for the face over the forehead. So if you see the slide, you will get like two fingers will be together, then you have to spread out the fingers. So you can use this type, Or if you want to use the complete one also, you can use like this. But it will be little difficult. So this will be more easy. You can just
Okay.
spread out the fingers from one area to other.
Miss, the friction is have to parallel or perpendicular to the muscle fiber.
Yes. So this is parallel.
Parallel, yeah.
This one we are doing is parallel.
So can perpendicular also lah.
You can do. If you have scar tissue, if you have adhesion, then you can do.
Thank you, Miss.
Because friction is mainly to break the scar tissue and break the adhesion. So if you have it, you can do it. So simply just for facial massage, you don't need to do. Because if you do, then there will be more chance for wrinkle formation.
Oh,
Okay.
So any other doubt? Can I go to the next group?
Yes, Miss.
yes.
Miss,
Yeah.
Thank you,
Then.
Miss.
another question. How many times should we do the effleurage?
Actually, it depends on the area and it depends on the edema or fluid. Okay, so if you are able to clear out all the fluids in 2 times, then it is enough if you do only 2 times. That is in one area 2 times. That means like this once, then second time. So if you feel in 2 times you are able to clear the fluid in that area, that is enough. But if you feel you need more time to clear the area, then you have to perform 3 or 4 times. Especially if you are doing on, I think case number 6. If you are doing on edema person, after mastectomy, they will be having edema. And if you are doing on them, you will need more times because there will be backflow of the fluids and the fluids will not drain out properly. So it depends on the condition of the person. Then it depends on the area. So here face is very small. So you can just perform 4 times and you will be able to cover the complete face. But in case of back, you need more number of times.
Oh, okay. Thank you, Miss.
And
Miss, how do we?
why you are doing in between each technique means every technique will have little amount of fluid produced. So you need to drain that fluid. That's why you are doing the effleurage intermittently.
Miss, how we know how much fluid is in the face?
You will, on seeing itself, you will know. The face will be like, when you palpate and see, the face will be edematous. And you can see the difference. For example, if you see right side and left side, if the person has left facial palsy and if they have edema, it will be swollen right. So it is on observation, you will be able to find it out.
Okay. Thank you, Miss.
Any other question?
No for me, Miss.
Okay.
Thank you,
So
Miss.
you just remind, I'll go to the other room.
Okay.
Okay.
Which break room is it?
Room 2, Miss.
Room 2. Okay. So do
Yeah.
you have any doubt?
Yes, Miss. We do have questions.
Yes. Asking.
Miss, for hacking, do we need to be from proximal to distal?
Okay, so this depends on what is the condition. So like yesterday, if you are performing on a person who is having reduced muscle tone, then you have to do from distal to proximal. If you are performing on a person to reduce the edema, then you have to perform from distal to proximal. On all other cases, it can be either proximal to distal. Actually, like we have 6 types of cases: pain, spasm or tightness, reduced muscle tone, reduced muscle power, increased muscle tone, and edema. So in case of edema, in case of reduced muscle tone, in case of reduced muscle power, you will be doing from distal to proximal. Okay. Then in case of increased muscle tone, you will increased muscle tone, you will and increased muscle spasm, you will be doing from proximal to distal. Other conditions like pain, you can do from any direction, no issues on that.
Miss, muscle spasm also from any direction also can, right?
Muscle spasm means it is increased muscle tone, right? So you need to do from proximal to distal. But if it is a localized muscle spasm, then you can perform from any direction, no problem. Actually, muscle spasm can be because of spasticity, that is your neurological problem. In that case, you have to do from proximal to distal. If it is a mild muscle spasm localized only over a particular muscle, then you can perform from any direction.
Okay, Miss.
Okay, so what is your question? What is the case scenario?
We are doing case scenario 2, which is a 35 years old person is presenting a complaint of
Okay,
sleep.
back massage, right?
Yeah, back massage.
So here in this case, since it is pain, you can do from any direction, but you need to perform everything in the same direction. That means all the technique. If you're starting from proximal to distal, all the techniques will be from proximal to distal except effleurage.
Okay, if I'm starting from distal, also the whole thing must be from distal, is it?
Yes. That means hacking you have started from distal, then everything you have to do from distal. That is skin rolling, circular kneading, everything should be from distal to proximal.
Okay, thank you, Miss.
Because this will help you to relax the muscle. If you're doing opposite manner, then the muscle will not be relaxing that much. That is, the muscle fibers will not be relaxed.
Okay, thank you, Miss. I forgot to ask.
Okay, others, any doubt?
Miss, for the period of time to do the massage, do we have a specific time range?
Actually, like we don't have specific time range. Again, it is depending on the condition only. And it is also like practically, if you're seeing, it is also depends on our time, that is physiotherapist time. So for example, if a person is coming with Bell's palsy, you will be massage is one of the treatment technique. You have to give electrical stimulation, you have to make them to do the exercise, then massage. So all three, it depends, like you can't spend 3 or 4 hours together for one particular person. So accordingly, you will be deciding maybe some 15 minutes or 20 minutes per massage, like that. So in that case, again, a number of repetition of the technique also should be equal. So if you are giving hacking for 4 times, then all other technique also you have to give for 4 times. So according to that, you have to decide. So our main concern is you have to cover up the whole area rather than how many number of times. So for effleurage, if it is taking 4 times for you to cover up the whole area, then all other technique also 4 times.
Okay, thank you, Miss.
Thank you, Miss.
So if you don't have any other doubt, I'll go to the next room and come.
Okay, Miss.
Sure, Miss.
I think this is group 3, right? Do you have any doubt? What is your case scenario?
Means our case scenario is the person's hand is the skin contracture and then unable to extend the elbow.
Okay, scar tissue.
Yeah. Then Miss, I want to ask for the friction, right? For friction for the elbow, right? We do on insertion part or origin part.
Actually, you can do on both insertion and
Oh, you can
origin
do.
also you can do. Yes.
Okay. Then because the
But
insertion is
mainly you have to see, you have to palpate the muscle and see where is the tightness.
then
In case
yeah,
if
that's
there
why
are
I
no
cannot
tightness,
find the
okay, in the question it is not clear. But
I miss.
actually when you are doing on a patient, you will be able to see it. See it means you have, when you are
Oh,
palpating, you will be able to find it out. But in the question, it is
okay.
not given.
Okay. Because it's very hard for us to know where to do friction on the tendon.
So this is just a sample questions. Like your OSPI questions and all will be in more detailed form,
Okay.
and
Okay.
your theory questions also will be more detailed, so that you will be able to get everything, like
Okay.
all the details you want.
All right, Miss. Then, Miss, I want to ask, for the for hands, right? You do for compression because one side you're holding for stabilization for the patient to do flexion for the arm, and then the other hand is where you do massage, right?
I didn't get you. Can you repeat?
Because we put the patient in a supine lying position, and then one hand is used to support the hand, and then the other hand is used for massage, right?
Okay. Yes.
And
Okay.
then for compression, right, it's normally used for how to say, so for compression we just use one of our hands.
Yes, you can use one hand because the area is also small, so you can use.
Okay. So does it need to be like laterally to medially or medially to laterally or something like that? No
Yes,
need, right?
it should be uniform. That means if how all other conditions you are all other techniques you are giving. So all other techniques, if you are starting from distal to proximal, then this also should be from distal to proximal.
Okay. So for me, for this is because this one is the skin contracture, so we want to decrease the muscle tone, so we use from proximal to distal.
Okay, so proximal to distal, all the things you have to do from proximal to distal.
Oh, okay.
But effleurage you have to do from distal to proximal
Yeah.
only.
Then we drain the fluid, right? So because for me this is just arm only, so I can say use effleurage just like the whole hand of the use
No,
whole hand
you
effleurage.
can start from wrist to elbow. To elbow. Yes, that is enough.
Okay, so I don't need to do like spiral kneading.
In case if the person has swelling, then you can do, but otherwise you don't need to do. Here in this question, it is mainly for your scar tissue mobilization. So you need to concentrate on the scar tissue area. So they have given anterior aspect of the forearm. So it is enough if you do only anterior aspect of the forearm.
Okay. Then effleurage, I just use one type of effleurage can already. Like if I use ulna, I just use ulna effleurage.
Yes, can do.
Okay. All right, miss. Thank you. That's all.
Any other doubt? Okay. So if no doubt, I'll go to the next room and come. Hi. So I think this is the break room number 4, right?
Yeah.
So do you have any doubt?
Should be so far so good. I thought I will carry out, we know it.
So did you discuss among yourself?
And yeah.
So no doubt so far.
So far so good.
Okay, so I'll go to the next room and come. Hi.
Hi, Miss.
So did you practice?
Yes.
Any doubt you have?
Miss, I got one question based on the case scenario.
Yes.
The upper limb, for the upper limb massage, we need to do from proximal to distal, right?
Okay, so in your case, I think the 5th case, right? So the person is having no tone, isn't it? What is your question?
The question is, a 70 years old person is presenting a complaint of weakness in left upper and lower limb past 20 days. Physiotherapist assessment revealed increased tone in upper limb and muscle power.
Increased tone or reduced tone?
Increased tone.
Okay.
Increased tone in upper limb, so that we need to do from proximal to distal, right?
Increased tone means you need to do from proximal to distal.
Then if we do the massage from proximal to distal, for the upper limb, we need to do spiral kneading on the fingers, right?
Yes.
The spiral kneading is we need to drain the fluids to the upper limb, to the from the finger to the wrist to the elbow to the shoulder, right?
Yes.
Then if we do proximal to distal, how we do the spiral kneading and drain the fluid?
See, here our main aim of this massage technique is, in your case scenario, it is to reduce the tone of the muscle. That is our main priority, okay, rather than draining the fluid. So in this case, you need to concentrate to reduce the tone. So that's why you are starting from proximal to distal. Is that clear?
So that we no need to do the spiral kneading on the fingers.
You need to do, but you will be doing at the end. That means if you are, you will be starting all the technique from shoulder, then you will be going towards the hand. Except effleurage. Effleurage alone, you will start from distal to proximal. In case if you're not dividing the patient into segment, then effleurage you will start from fingers. That is, you will start your spiral kneading and do the effleurage from the wrist to shoulder. After that, you will give all other technique like hacking, pin rolling, circular kneading, everything you will be doing from shoulder to hand.
Just for effleurage, we need to from distal to proximal.
So always effleurage will be from distal to proximal. All other technique will be from proximal to distal for this condition where you want to reduce the muscle tone.
Okay, thank you, Miss.
So in case if you want to increase the muscle tone, again you will be doing from distal to proximal. All the techniques from distal to proximal.
For increased muscle tone, we need to do from proximal to distal. Then increased muscle tone, we need
the patient has increased muscle tone and you want to reduce the muscle tone. That means you need to do from proximal to distal.
If the patient want to increase the muscle tone?
You want to increase the muscle tone means you need to do from distal to proximal. That means the patient doesn't have muscle tone and you want to induce the muscle tone. In that case, you need to do from distal to proximal.
Okay. Then for this case scenario, is the weakness of the upper limb, so that we need to increase muscle tone, so that we need to do from distal to proximal, right?
1 second, let me just read the question and come back. The patient, the physiotherapy assessment reveals increased tone in upper limb and muscle power 0.5 in almost all muscles in lower limb. So that means the patient has increased muscle tone. Okay, in the upper limb, the patient has increased muscle tone, and in lower limb, the person doesn't have muscle tone. Okay, so that is that is revealed from the physiotherapy examination. So in this case, for the upper limb, you need to do from proximal to distal so that you can reduce the muscle tone. The person has increased muscle tone. Here you have to normalize the muscle tone. You have to bring the muscle tone to normal. So in this case, you have to do from proximal to distal. For the lower limb, the person has zero muscle power. So you need to do from distal to proximal to induce the muscle tone. Induce means to increase the muscle tone. Is that clear?
Oh, yes, clear.
So others, any other doubt you have? Okay, so I'll go to the next room and come back. Hi, everybody. I think this is sixth group, right?
Oh, hello, Miss.
Yes, Miss.
Okay, so do you have any doubt?
Miss, the friction, if apply for the upper limb, how to do it?
Friction has to be applied over the joints. Okay, so over the bony area. So upper limb means you can apply the friction over the metacarpal bones, over the metacarpal joints, over the wrist carpal joints. So you can apply over here, here, all the joint body prominence you can apply. You can apply over the wrist, then you can apply over the elbow like that. So you cannot apply over the muscle. You can apply over the muscle in case if you want to break the adhesion. Break the adhesion means if they have any scar tissue and you want to break it, you can apply. But if it is very smooth muscle, then no point in giving friction over the particular area.
Oh, okay, thank you, Miss.
So others? Okay. So if no doubt, then I will close the Okay, so I have closed all the break rooms. Everybody please join the main session. Yes. Anybody has any doubt? Okay, so if no doubt, we will go into the discussion part. So already, I hope everybody have already selected a leader in the group. So group one, you can come and discuss about your question. So group
Okay,
one,
okay. Hi, Miss.
yes.
Should I need to open the camera?
If you want to demonstrate, then you can open. Actually, like
Okay.
rather than demonstration, I feel like you need to tell me why you have chosen this particular, like what are the techniques you have choose and why you have choose the technique. That's it.
Okay. Okay. So, um, after going through this situation, knowing that the 20-year-old girl has unable to close her left eye properly and also find difficulty in drinking water. So after he have diagnosed the left facial palsy, have to give as physiotherapist, we will give a facial massage for the patient. So first and foremost, we're gonna ask for any contraindications. So like high fever, renal disease, also the cardiac disease, and also the skin infection, open wound, and even more. If there's no any contraindication, I would like to have the patient consent. So okay, so for the face massage, the first thing I'll be doing is stroking. Why do I do that? Because like I will have the patient to use to it, like feel that get over my hands. Okay, so I'll be doing like from from down to up. Okay, so for the frequency I'll be doing like depends on from person to persons. So from according to these situations, the patient is having a facial palsy. That means they might have a edema, which means that swelling the fluid inside the face. So I'll be doing more times, like 5 times. Next, I'll be doing Ifiraj. So Ifiraj will be from up to down. Make sure that covering all the faces. Same goes to stroking. Make sure that you do covering all the faces, the left part of the face. And then, so for each action, we'll like, let's go on. So for the transverse friction over the face, over the forehead, I'll be doing. So we're using our two fingers, pushing the forehead. We're doing parallel to the muscles. So normally friction will be applied through the bony area. And then we'll go for Ifiraj. Then we'll go for the circular friction over the orbit, which means that we're using our time do the circular friction over our eyeball, like over the surface of the eyebrow, of the muscle near the eyeball. And then we'll go for the Ifiraj. Then next for the stroke orbits, we'll be using the two fingers and do the stroke orbit, that's mean the massage over the eyeball. Then the Ifiraj. Then then will be the circular friction over the face. Okay. Then are we going through the Ifiraj, then the tapping. So the tapping, I'll be using my fingers, the four fingers, like tapping pianos over the face, the left side of the face, for forehead, then go down to the cheek, then go down to the chin. Then we should go for the Ifiraj, then the circular kneading. So circular kneading, I'll be using the finger kneading. Then will be the Ifiraj. Then will be the hacking. So I'll be using the hacking especially on the cheek muscles, which is the bulky muscles. Then lastly, we'll be doing the compressions. Make sure that using our whole palm area to give a compression over the the forehead, over the cheek, over the chin, over left side of the face. That's all for me.
Okay. So according to this condition, the main problem of the patient is uh, because of the Bell's palsy or facial palsy, the person will have reduced muscle power in the face. Then they will have sensory problem also. So our aim of doing this massage is to improve the muscle power and enhance the muscle tone. Okay, so enhance the muscle tone means like to improve the muscle tone. So that is our major aim. So for that condition, like whatever you have chosen, the technique is correct. So you can do all these techniques. Okay, so there is no like there's nothing wrong in whatever technique you have chosen so far. Okay, so others, anybody has any question regarding this question in this case scenario? Okay. So how you do, how you perform is, I want all of you to go through the case scenario and practice at home. Then come and ask your doubts maybe in the next class, or you can also ask me through WhatsApp. So don't just leave it like this. You have to keep practicing. Then only it will be easy for you to do during your OSPE. So don't just after the class, like don't just leave it as such. Is that clear? Okay, so next group.
Good afternoon, Miss.
Yes.
Based on the case scenario, the patient is a 35-year-old person and is having a muscle spasm on the back muscle. So from the start is I'll be introducing myself first, and then I'll be asking for the contraindications from the patient. For example, high fever, cardiac disease, or renal disease. And then I'll be explaining the procedure to him or her. And then I'll be getting him or her consent. And then I'll be doing back massage on the patient. Firstly, I will let the patient to lie down in prone lying position. And then after the patient remove his or her clothes, I will first be touching, which is spreading the lubricant, and then I'll be doing stroking to let the patient get used to my touch. And then I'll be doing effleurage 3 to 5 times, starting from the middle and then up to the lateral side. And then after that, I'll be doing circular kneading with whole hand kneading from distal to proximal. And then after that, back to effleurage 3 to 5 times. And then I'll be doing skin rolling. And then effleurage again. After that, I'll be doing picking up at the lateral side at both sides. And then after that, I'll be doing effleurage back. And then I will start doing friction over spinous process, which I will find the PSIS first, and then locate the spinous process, and then do with the thumb, find the spinous process, and then do circular motion 3 to 5 times, and then from distal to proximal. After that, I will do effleurage again, and then I will do hacking, but not near the kidney side to prevent hurting the organ. Then after that, I will do effleurage, and then we'll do compression or beating or either pounding, and then we'll end the session with effleurage. Yeah, that's all for me.
Okay, so anybody has any other doubt?
Miss, I want to add on. Tapping and ringing is not allowed in back massage, right, Miss?
It is not that not allowed. It is like tapping is a very light form, lightest form. So if you give tapping over the back muscle, it will not have much effect. And ringing, you cannot hold the muscle. Back muscles will be little bigger, and doing ringing will be difficult. But in case if you have any scar tissue over that particular area, you can still do ringing. So it is not something like you cannot do. You can do, but depends on the condition. But most of the time, tapping will not be useful at all. But ringing still you can give if you have a mild, if the person is very thin, and if you are able to do ringing, you can do over the lateral side. No issues on that. Okay. But depends on, if it is for back pain, then no use in giving ringing. So if it is back pain, then you can reduce the adhesion techniques and you can increase the relaxation techniques. Okay, so no point in just keep on giving skin rolling and other thing without having any adhesion formation. Is that clear?
Okay, thank you, Miss.
And you can still do friction on the spinous process and transverse process. So whenever the person is having back pain, definitely they will have reduced muscle movement, reduced range of motion on the spine. So that's why we are giving friction on the spine. Okay, so you can give friction on the spinous process as well as transverse process.
Okay, Miss.
Okay, so next group.
Miss. Hi, Miss. Hello.
Yeah, tell me.
Oh, okay. So my group one is the case scenario 3 where the 8-year-old girl is unable to extend the elbow, and then is having skin contraction. So mainly we'll do the supine position, and then to improve the skin contraction, we'll implement into petrifage, effleurage, some compressions.
Okay, so
and then
what type
also
of effleurage you want to choose?
Yes, Miss.
What type of effleurage you want to choose?
The effleurage will do the effleurage. I'll do the ulnar effleurage because it's smaller surface area, so it's easy to push. There's more force that can be exerted if that is needed. But since she's a kid, so we'll just do for mouth pressure. And then for this, we'll put the patient in a supine position.
I didn't hear properly. There was some internet problem. Can you repeat?
Oh, sorry. So we'll put the patient in supine position first. Then we'll start off with touching first. So the patient will be in a supine position with one hand being stabilized by the therapist, with the other hand doing the massage. And then
so you can also make the person to sit on a chair and keep the hand over the cot.
Oh, okay, I see.
So this will be a little more easy for them. But nothing wrong in making the person lie down. Being an 8-year-old kid, nothing wrong in making them lie down. But this is an alternative position is also there.
Okay. Then after that, we'll put lubricant or any powder. Then after that, apply it onto the skin. When applying to the skin, we first put with touching first. It can be superficial or can be deep also. But I think for kid, I think we'll go for superficial touching, and then just to apply around the area of the forearm where the elbow is the muscle of the elbow is important. Then after that, we'll go for stroking. Stroking can be go from distal to proximal through mouth pressure, and then from proximal to distal mouth pressure, and then distal to proximal with mouth touch. And then after stroking, we'll go for effleurage. Effleurage we'll use ulnar effleurage because it's easier, because since it has small surface area, you go for ulnar F4H to be more efficient. Then after F4H, we'll then continue with kneading, circular kneading. And then circular kneading will go from other than F4H will go from proximal to distal, so that it's able to drain. From distal to proximal, so it's able to drain all the fluid. And then all the other massages will go from proximal to distal, so that's able to reduce the muscle toning for the anterior region. Then we'll go for circular kneading, where we use the thumb for circular kneading, or the knuckle circular kneading, so that it's easier because it's a small surface area. Then after that, continue with F4H, and then we'll do friction. You can do friction at the origin of the muscles, such as the bicep. For this is near the radial tuberosity. And after that, we'll continue doing F4H, and then also we can go for compression. Then after compression, we'll then go for another F4H intermediately, and then after another F4H, we'll then do for maybe hacking. We'll go for hacking. So also it's the same where it goes from distal to proximal. Yeah, from proximal to distal. And then lastly, maybe we'll go for then we'll go for F4H again. And lastly, we can go for maybe picking up or skin rolling.
Okay. So is it that's all, or you want to continue?
Yeah, that's all, miss.
Okay. So any other suggestion from others? Okay, so here the question is very clear that person has skin contracture. Okay, so here our main aim is to reduce the contracture. So it is same like your scar tissue. So our aim is to reduce the scar tissue. So you have to concentrate more techniques which will help you to break the adhesion, like skin rolling, picking up, bringing, friction. All these techniques will help you to break the adhesion. So you can mainly go with this technique. But in between, you have to also give circular kneading, another relaxing technique, so that the skin, the muscle is getting relaxed also. Is that clear? Okay. So if no doubt, then we can go for case scenario 4.
Okay, miss, can you hear it?
Yes, continue.
All right, so for our case, we have a old person who is presenting with the weakness in left, means the upper limb and lower limb for the past 20 days. So on our assessment, the limb are literally no power actually. So we got to describe the massage design a massage therapy for him. So our main concern on this kind of massage therapy is to help him to regain the muscle tone and some muscle power. Then the second thing is, since he's like 70 years old, that means like he may have the case we suffer with osteoporosis. So our technique should not be applied with a forceful technique. So everything should be soft and And then another thing is due to its muscle tone. So our technique of application will be start from distal to proximal. So first of all, then another concern thing is we need to check whether he has any cardiac disease, any fever, since like old man, right, easy to get those disease. Okay, first of all, for the position of the patient, in this case, since I have to do for the upper limb and lower limb, so I prefer it to position in a supine way. It's more easy. Then start with the upper limb first. So start from performing, I can apply a gentle mild touching and then apply some lubricants on it. Then can start to perform the F4H and some stroke. Then F4H, I will be choosing something like thumb. If he's a very bulky old man, then maybe some fist or ulnar is okay. But if really thin, then thumb is more than enough. And then nextly, after applying the F4H, then can start to performing the circular kneading start from the distal means like the wrist to the elbow and to the shoulder, and then hacking, some picking up technique, compression, not very forceful compression. If a very mild compression is enough, and then kneading also from the wrist to the shoulder. Okay, kneading, ringing. Okay, so all these techniques should be applied in a very lightful way, and then in between want to apply a few rush is also okay. And then for the metacarpal bone means like the finger at the bony area, it can apply some friction, some kneading and some rotation there. But for the finger, it's no need to apply for the rush. But for the other part like wrist, by the elbow, the forearm and the arm, it can be applied with rush. Then since we need to train up for more muscle tone, so our frequency of performing should be increased. Then for the lower limb, also the same, apply lubricant with some touch, then some lubricants with a small, okay, with some brush and straw. And then for the toe side also can, for the toe, for the bony prominence can also be applied with some of the friction. And then for friction, kneading and some rotate. Okay, meanwhile for the leg, until the hip, they can apply some kneading, ringing, circular kneading, and then some hacking, and can be applied a few rush in between, and also lastly can apply the compression. So can apply the compression, after the compression also can apply some few rush. So for the same theory to the upper extremity also, it should be applied in more frequency but very mild since omen. Okay, I think that's all in very general terms.
Okay, so I think like case scenario 5 also almost same. I think fifth batch, do you want to add up anything with this? Since it is same question, I'm just going, we don't have much time. That's why I'm a little bit rushing. So like break room number 5, do you want to add up anything or everything is same?
The difference between the case scenario question 4 is for the upper limb massage, we must do from proximal to distal because the tone is increased. We need to reduce the tone. Just add on this only.
Oh, okay. Yeah, that's correct. So here, both the case scenario, the person is having weakness of upper limb and lower limb. Weakness means reduced muscle power. Okay, so just for your understanding, anyways, like maybe during the theory class when they are taking up tutorials, they might tell you a little bit more about the terms. If they have not told you, that is Ms. Vani has not told you, then we will have a tutorial session to talk to know more about the specific terms. Okay, so here weakness means reduced muscle power. Is that clear? The other medical term for this weakness is paresis. Paresis means weakness. Paralysis means totally no muscle power. Is that clear? So the word paresis means weakness. Paralysis means totally no muscle power. So that is the difference. So here, since they have given weakness, that means reduced muscle power. So the physiotherapy assessment, that is physiotherapists have assessed the person and found out that the upper limb doesn't have any muscle tone and lower limb muscle power is almost 1/5. That means both the limbs are almost no tone and reduced muscle power. So in this case, like you have to give all the technique from distal to proximal. So depending on the person bulkiness, you can divide into segments or you can also give together. Okay, so that is in the case of case number 4. Case number 5 is here the same thing, weakness, but the physiotherapy assessment revealed that there is increased tone in the upper limb. So that means the upper limb is spastic, increased tone, and lower limb is no tone and no muscle power. So upper limb, you have to start from everything, you have to start from proximal to distal except effleurage. Okay, lower limb, everything you have to give from distal to proximal. Okay, so that is the difference. Then like next group 6.
Yes, Miss.
Yes.
So our group will be going to the case scenario 6, which is the patient is suffers for edema, and then we have to, in her upper limb, we have to do the massage on the upper limb to reduce the edema. So after introducing and explaining the purpose, checking the contraindication and asking concern, we will position the patient into supine lying, and the arm should be elevated since the patient is suffering from edema. Then we will put powders or lubricants for the touching, then followed by stroking with the fingers. And then next we will be the efflux from the distal to proximal. In this case of edema, we will concentrate more on efflux, which we will do maybe 4 to 5 times until the swellings is reduced to drain the fluid into the axillary lymph nodes. Then we may also divide into segments. For the hand parts, since we can do the thumb or the forearm efflux, we will choose the spiral kneadings, start from the fingers, so the fluid will be drained into the metacarpal, and then we, like this for twice or 3 times. Then we will also go to friction over the bony area, such as the metacarpal joints. Then we can also do ringing over the palm. Then we will again go for efflux. Then from the forearm and the arm part, if the patient is bulky, then we can separate it from the wrist to elbow, and the second part is from elbow to the arm. If the patient is thin, we can straightly do for forearm, do from the wrist to the shoulder to drain into the axillary lymph nodes. So firstly, we can do the thumb or forearm efflux from the forearm to the arms. Then we will go for circular kneading by using fingers or by either using fingers or thumb. Then again, we will go for thumb or forearm efflux with twice or 3 times. Then we can do hacking on either side of the forearms with only either side of the forearm with only one hand. Then we can again go for thumb or forearm efflux twice or 3 times. Then we will go for picking up or ringing at the both sides. Then we will go for efflux with twice or 3 times. Then we will again go for compressions. Then we will end with efflux, and we will focus more on efflux to do until reducing the swellings. That's all for me. Thank you.
So anybody wants to add up? Okay. So overall, the thing is, even if you are, everything seems to be like same, that means same means everything for almost all the conditions we are doing all the techniques, but still you need to know where you want to increase or which technique you want to concentrate more and which technique you want to concentrate less. So that means, like for example, if you take up the 6th case scenario, here our aim is to reduce the edema. So we need to do more of effleurage, more of circular kneading. That means more you can increase the number of effleurage technique so that you will be able to drain the fluids faster. Okay, so rather than other techniques, so all the draining techniques will be done more. So draining techniques means like your circular kneading also will help you to move the fluids from that particular area to the other area. Okay, effleurage is overall pushing the fluid towards the lymph node, but other techniques like circular kneading, your ringing, picking up also will help you to just move the fluid little bit here and there, and overall effleurage will push it out. So according to that, you have to design the technique. So for your scar tissue, you have to do more of the picking up, bringing, friction, that kind of technique. for this, you have to do more of effleurage and circular kneading technique. Is that clear? So same thing for the weakness and other thing. So here you need to do in such a way that you are stimulating the muscles to act. So here the muscle doesn't have muscle power, muscle doesn't have tone. So you need to stimulate the muscle to act or to take up the contraction. So you need to use more of beating, pounding, picking up, hacking techniques so that you are inducing the muscle to move. Is that clear? So more of that technique has to be used. So like this is the variation between all the case scenario. And for OSPE purpose, we just say that we need to do all the techniques this many times uniformly. But actually for the clinical in practice, in reality, you will be using certain techniques more, so that you will be able to induce the particular proper, you will be able to achieve the proper use. So only for the OSPE purpose, just for uniformity, we are saying this many number of times and other things. Is that clear? So if you have any other doubt, you can just keep a note and we can discuss in the next class, or you can also WhatsApp me then and there to clear your doubts. So yesterday I got one doubt like from one person, that in case of mastectomy, if they have removed the lymph nodes, where to drain? But actually when they are doing the surgery, they will not remove completely all the lymph nodes. So there will be few of the lymph nodes or ducts remaining to collect the fluid. Is that clear? So they will remove only the affected lymph nodes. So you can still drain it to the armpit or to the cervical lymph node. Nothing wrong in doing that in case of mastectomy. So if no other doubt, I think the next class person is waiting to log in. So if no other doubt, then we can leave the class. Okay, so thank you all.